This podcast has been sponsored by GIPsychology.com. Maintaining a healthy gut is key for overall physical and mental well-being. Whether you're a health-conscious advocate, an individual navigating the complexities of living with GI issues, or a healthcare provider, you are in the right place. The Gut Health Podcast will empower you with a fascinating scientific connection between your brain, food, and the gut. Come join us. We welcome you. Hello, friends, and welcome to the Gut Health Podcast, where we talk all things related to your gut and well-being. We are your hosts. I'm Kate Scarlotta, a GI dietitian.
And I'm Dr. Megan Reel, a GI health psychologist. And we are diving into a novel and exciting topic today. The topic, psychedelic therapies and the potential role in gut health as well as far beyond. We're very excited to welcome our guest today, and we're going to kick things off with Dr. Emeran Mayer, a gastroenterologist, neuroscientist, and distinguished research professor in the Department of Medicine at the David Geffen School of Medicine at UCLA. He's the executive director of the G. Oppenheimer Center for Neurobiology and Stress and Resilience and founder of the Goodman-Luskin Microbiome Center, also at UCLA. He is one of the pioneers and leading researchers in brain-gut microbiome research, and he has published well over 400 highly impactful scientific papers and co-edited 3 books. He also has his own books, The Mind-Gut Connection, which sits on my shelf, The Gut-Immune Connection, which was published in June of 21, and the recipe book, Interconnected Plates, in 2023. You may have also caught him on TV or in the air because he's got a masterclass, and the PBS documentary is available for you to check out too. Among many prestigious honors, he was awarded the 2016 David McLean Award and the 2017 Ismar Boas Medal. We are so thrilled to have him.
So it's my pleasure to introduce Dr. Erin Mauney. We have 2 guests today. Dr. Mauney is a pediatric gastroenterologist and obesity medicine specialist at Tufts Medical Center here in Boston, where she focuses on innovative treatments for complex digestive and metabolic disorders. She maintains a research appointment at Massachusetts General Hospital, leading a study on psilocybin-assisted therapy for irritable bowel syndrome. She is passionate about exploring how emerging mind-body therapies can transform patient care and quality of life. Psychedelic therapies have been around for thousands of years, but the modern story really starts in 1943 with the discovery of LSD. That moment kicked off 2 decades of research, including more than 40,000 patients and over 1,000 studies using LSD alone. By the 1960s, psilocybin, which is the active compound found in certain species of what we call magic mushrooms, was being explored for psychiatric symptoms and addiction. At Harvard, psychologists Timothy Leary and Richard Alpert helped bring it into the spotlight. The results? Leary and Alpert's controversial psychedelic experiments at Harvard led to their 1963 dismissal, ending their academic careers, but launching them as counterculture icons. Leary was later blamed for the backlash against psychedelics, lost credibility. Yet research into their therapeutic potential, especially for anxiety, depression, and addiction, continued worldwide.
Yeah, it's fascinating because then came the Nixon era and really this war on drugs. And much of this research was abruptly shut down, even as studies were very active. And this went on for decades. And so recently, there's been a resurgence of interest, especially in the areas of substance use and eating disorders. However, today, we are talking with these 2 experts about how these therapies may offer new hope for conditions like IBS by simultaneously targeting brain-gut dysregulation, as well as the common comorbid mental health conditions that come along with them. Dr. Mayer, from your perspective, how might psilocybin or some of these other psychedelic therapies, integrating them into the evolving understanding of the brain-gut microbiome connection?
Yeah, as a disclaimer, I had my first experiences with psilocybin not in the 60s or 70s as party drugs. I somehow bypassed that phase, but I was introduced to them by a young physician who plays a significant role and spends a lot of effort in legalizing psilocybin. And so I had a few, or I should say, we, together with my wife, we had a few sessions in our house with this individual. There were guided sessions. It was just such a remarkable experience. I have to say that, and most people say that do it under guidance or, for a spiritual reason, that it has profoundly changed the way that you look at reality. It's just that you have this experience of intense interconnectedness with your surrounding, if you do it in nature, that your breath is synchronized with the movement of the mountains around you and then the colors. It's both a beautiful experience, but also it's a really profound psychological expansion of the way you look at things, and it stays. It's not just during the actual session. It lasts, I mean, like initially a couple of weeks, but it hasn't really gone away completely. And I have to say it fell in my case on fertile soil because I've always been interested in Jungian psychology, debated before I went to medical school if I should go into psychology. So this has always fascinated me. And then that experience is this self-experience really re-emphasized the importance. And since it has such a profound effect on the brain and, being a strong advocate of the brain-gut connection, there almost has to be this connection with this altered communication between the brain and the gut, even though we don't know as much about this as we know, for example, about the 5-HT2A serotonin receptor in the brain, which seems to be the main mechanism for the psychedelic experience. I think thinking about it as a scientist, I mean, I wish I could dial back my career 20 years and get into the psilocybin field and the brain-gut interaction. This assumption now, it's pretty more than an assumption that it has neuroplastic effects. It can actually change circuits. I mean, there's very few therapies that we have today in psychology, certainly not in the treatment of functional GI disorders, that has this ability to actually change circuits. And so that I find really attractive because clearly IBS is not something that you get for a month or for. It's usually, if you take a detailed history, it's a pattern of your brain and how it interacts with the gut that often goes back, to childhood, maybe not manifesting in the gut, but manifesting as anxiety. So to be able to reprogram this is fascinating. And I think the potential, both in psychiatry, but also in functional GI disorders. The one thing, and we may come back to this question. So I looked as much as I could to find out. My initial thought was, well, one of the best explanations would be if these 5-HT2A receptors are present on certain microbes and you can actually change the behavior of the microbes. And surprisingly, could not find that evidence. There's a few papers that state that they have not been detected on, but they are present on parts of the gut that regulate the habitat in which the microbes live in. So motility, secretion, blood flows, serotonin release. So it's most likely an indirect effect that they have on the gut. And they also, some vagal nerve afferent sensory fibers express that receptor as well. So, which is always a big thing because, vagal stimulation is being debated as a potential treatment for IBS.
I thought it might also be helpful to add that while kind of the serotonin 5-HT2A receptors get all of the glory in terms of causing the psychedelic effect, psilocybin is actually a relatively non-specific serotonin agonist, meaning it acts at many different serotonin receptors, including ones that are widespread in the gut, in addition to the 5-HT2A ones. And I wrote a review article with some of my colleagues at MGH, which is out in ACG, I think a few months ago, or Journal of Clinical Gastro, that kind of looked at some of these potential putative effects and where psilocybin could be acting. We need a lot more basic science to kind of pin down exactly where that might be. But these serotonin receptors are used just very widely in the body, even in addition to being expressed on gut neurons. We see them also on different components of the immune system. And so this interaction between the microbiome and the immune system, it's just this like very delicate dialogue. And I think it's, very likely that there are some indirect interactions there as well. So I think we need a lot of help from basic scientists to figure this out, but there's so many places that could be acting peripherally that just haven't really been studied yet.
So interesting.
And Dr. Mayer, do you think there are certain personality constructs that make somebody more of a good candidate for this? So you were describing personally, some things about yourself spiritually and maybe from an openness perspective. Do you have some insights on that?
Yeah, so what I noticed talking about this topic, so a lot of people, older people have tried psilocybin and other psychedelics in the 70s as party drugs. Very few of them had a special experience. They said, yeah, it was fun. I loved the colors but I've not heard many times that they would say, God, this was the best experience that or the most profound experience, which a lot of the serious practitioners actually have reported. So there's I think, a survey. It's one of the most common things that people say was the most important, the most profound experience that they've ever had. I would say it's partially true in my experience as well. I mean, I've not experienced something that is comparable. And so if you go into this therapy as with your perception, yeah, this is a fun thing to do and it's entertaining, it's less likely they're going to help you. With one caveat, we've not talked about this whole microdosing phenomenon where you won't have these existential experiences. But we don't have enough data really to know, does this do anything objectively, or is it a big placebo that people say for a disorder like IBS or anxiety? Or I think with these kind of interventions, the placebo effect is always a good explanation looming over the reality. Being best prepared for it, yeah, clearly if you have some kind of a spiritual interest or psychological interest, you're probably a better candidate for that than somebody who comes cold to this field, because then you would need a lot of explanations and disclaimers what this is not. Overall, I think doing this initially together with a guide, an experienced guide, and I don't know how many psychologists are now trained in providing that kind of guidance. So in my case, the initial 2 sessions made a huge difference to have somebody who sort of keeps you focused on it. Because I would always ask questions during this session, what is this? What is this? And does this help me with this? And so this guide, this person would just say, I'm just your guide. It would never give me any concrete answer, but just focused me on the experience itself, which I think is important. And there's also this whole thing about the integration. This clearly opens up parts of your brain and your memories that you normally wouldn't have easy access to. I mean, some meditators do, but most people don't. And then when this material comes up, I've also personally noticed that you have a desire to talk I've never talked as open with somebody, including with my wife, for hours afterwards. So it does something to your whole processing, this openness and touching things that you normally wouldn't talk about. So I think that's also something that has to be an essential part of it. I mean, just getting a session, getting a shot of medication in an office and then leaving again, that probably would not have the same effect, I think.
Yeah, it's fascinating in looking into the history of this and some of the experiences in early research in the area of addiction. So, one of the founding fathers of AA claims that psychedelics helped him to basically break his addiction. And that's where a good bulk of research was in substance use and more severe psychiatric conditions in those early LSD years. So the fact that, like you're alluding to, in one or two or a couple sessions, these profoundly ingrained, significantly impacting psychiatric conditions could be altered and change the trajectory of somebody's experience in life is really fascinating. And there's a lot of hope there. But as you've mentioned, lots of hurdles in terms of the data and the science presently. And so I guess to kind of bring us back a little bit more to the present, what are some of the hurdles that you think stand in the way of maybe some of the research that Dr. Mauney is doing and Mauney is doing? And how do we get it to be part of mainstream gastroenterology? How far away are we from that?
Yeah, I mean, obviously, there's quite a few obstacles. It's not as well known and familiar to the majority of gastroenterologists. I mean, it took gastroenterologists a long time to accept the psyche as, this whole field of neurogastroenterology. It took a long time. I think this is another step that you hope, many gastroenterologists would jump onto. So that's definitely one hurdle. I mean, unless the physician who recommends this is familiar with it, both the benefits and the risks and the limitations, and can give a good explanation, I think it's difficult to use this as a therapy in a GI practice. Yeah, so the other thing is the financial, so the business side. This is like a pretty involved thing. This is not just telling somebody do your abdominal breathing or, go to this app and use it. So both from the person that initially does an intake, a psychologist, a trained psychologist, does an intake, does an assessment of that person, then guides this person during the session, and then helps integrating afterwards. I mean, this is not done in 15 minutes.
Yeah.
And there's not enough practitioners, as far as I can see, that have this ability. I mean, there used to be quite a few people, I think, probably in the 50s and 60s, who had these abilities, but they're not really available now for GI practice or for interacting with patients. So and this is obviously expensive. So let's say if you need at least 3 hours for the complete session and integration, I would say that those two things, the acceptance and awareness by the physician, by the gastroenterologist, and the business model to build this into a GI practice, I think is definitely two significant hurdles. I'm curious what Erin has to say about this.
Yeah, I completely agree with those being two very major issues that need to be figured out in terms of how to fit this therapy into the existing healthcare framework. A couple that I would add would be that, these are currently Schedule I drugs, which means that in the view of the FDA, they have no accepted medical use. And therefore, studying them is very difficult. So when I kind of naively set out to study psilocybin in IBS at the beginning of my GI fellowship, I would have never imagined the degree of bureaucracy and logistical hurdles would come up against. But you have to get things down to the level of like the safe that the drug is going to be kept in, inspected, and everyone's badge is looked at by the FDA and by the IRB at your institution and by the, state licensing board as well. There's just layers and layers of like almost this Kafkaesque bureaucracy. It's kind of ridiculous with something like psilocybin has like an incredibly high safe dosing, right? It's very hard to die from psilocybin. I don't think anyone ever has. And yet it's treated very differently. And so I think it just shows you kind of the discomfort that our society has with these medications. And I think that really goes back to sort of this like counterculture backlash from the 60s. Right. And the fact that these experiences that can be elicited by these drugs are so powerful and they can be disruptive to the status quo. And I think that the status quo, therefore, on the one hand, says that they want to study innovative medications and drugs that might improve human health. And they also, on the other hand, hold this at a distance with some anxiety towards it. And so that's just been very interesting to navigate. And people individually also hold their own biases and anxieties about these drugs. We've had people, nurses who are giving them in our clinical research center, push back against it or be very kind of uncomfortable with like music playing for the whole time, for example. Again, it's just not the way that other therapies are delivered. And so it's new and people have some anxiety towards it, I think.
Yeah. And I would say like it's never really spoken about at these conferences. I go to DDW ACG, every year, and it's not a big topic. And I know research is expensive and clearly there's obstacles, right? But
yeah.
with awareness, that's how things move forward too. And so, I'd love to see this topic broached at some of these conferences a little bit more so that at least it could pique some interest. I mean, when Dr. Mauney reached out to me when she was recruiting for her IBS study, I was like, what the heck is psilocybin? Let me just dive into this a little bit, and was so intrigued by just all the information that's really out there that I had no clue about. So I think it is, even this podcast, I think we'll get to some general consumers out there that have never heard of it like I really hadn't. And I'm in the scientific field,
And we're so embedded in the GI world. But I think the good news is that, like at the American Psychological Association conference this year, there were a couple sessions that included psychedelics. So 2025, there were some, additional sessions looking at this in terms of, again, more from a mental health perspective, but we're pushing the needle. And as we always know, bridging the psychological world with the gastrointestinal world, it comes with its nuances, as I'm sure that Dr. Mayer has lived with his entire career.
Exactly.
Well, it's funny you mentioned DDW because we've submitted 3 abstracts about this study to DDW, my study, and all have been rejected. So call me, DDW, if you're listening.
Yeah.
And I think in time it will be, it will be accepted and people will want to hear the results, whether they're positive or negative. And I understand that there is like a desire to study things very rigorously and not report on like preliminary data to some extent. So I understand that. On the other hand, doing these studies takes a long, long time. You have to screen a lot of people to find people who fit these like very narrow windows that, again, primarily because of the FDA and all of the regulations attached to them, people need to fit into to enroll in the study. And so it takes it's not like just testing like a new constipation drug and getting, 300 people and 6-month follow-up. It's just like a very different process. And I think this is not unique necessarily just to psychedelics. I think any sort of like brain gut therapy that psychologists are trying to study are also time intensive, lengthy. And so it can be hard just to get the data to kind of convince people. But I would love to see more openness in the field of gastroenterology and interest in just sort of like what we're doing and the possibility that these drugs could have. And I think that it's starting to spring up. We're definitely seeing it like bubble up. I've had different gastroenterologists reach out to me from across the country. I know that NYU is now also starting an IBS study. So with psilocybin. So I think it's starting,
right,
but we're just at the very, very beginning of it.
And there's psilocybin and psychedelic centers that are at big institutions around the country. This isn't just like some grassroots effort. I think there are big centers at Stanford, at Harvard.
Hopkins is in one of the centers for that, yeah.
Yeah, more commonly for psychiatric indications and not as many for mind-body kind of indications. But, it is outside the context of GI, but really every aspect of medicine has its like functional thing, I think these issues, kind of these brain-body issues, can be manifested through many different parts of the body, and chronic pain, if that's fibromyalgia or, chronic non-cardiac chest pain and cardiology. You could just sort of pick an organ and it would have its own equivalent IBS. And so what I think is exciting, even beyond the possibility of psychedelics for GI, is can psychedelics be used in this whole emerging kind of mind-body paradigm? And it's a little bit funny because I think we're like kind of recreating or like rediscovering how these molecules have been used by indigenous populations for a long time, even though they wouldn't necessarily say they're like treating IBS or have a construct like that. I think they have a sort of a much different view of how the mind and the body are connected and how these agents could be used to sort of reset or bolster that connection. And, they're often used in those practices in group settings. And so also how are they used in kind of the context of the whole society? So it really opens up a lot of questions beyond even GI, but more about like medicine broadly and how to improve human health.
And the thing is interesting that, this is a similar situation that I faced, as I said earlier, for 2 decades, just to introducing the brain into these so-called functional disorders. It's a similar barrier now, to introduce something that acts on the brain, probably primarily. I would also say a lot of data has been accumulated to show that there are differences in brain circuits, very specific differences, not general on the brain or psychology, but very specific changes at the brain stem level. And to have a compound that has the ability to change these circuits is by itself extremely exciting. We don't know exactly how to use it and what doses, and is the microdosing effective? Is that the better way to do it in the long term, more economically realistic? But it's also conceivable, I think, that this, I mean, nobody knows really in which direction this goes with the Mayer movement. There's clearly sort of a more critical view of pharmacological interventions. And I don't know if psilocybin and psychedelics will fall into a category that's being looked upon as more attractive. It's possible, but it could also go the opposite way. I mean, right now you don't really know how this is evolving.
Hi, I'm Dr. Megan Reel. As a GI psychologist, I've seen the powerful impact that gut-brain therapies can have for people living with gastrointestinal conditions such as IBS, IBD, and more. That's why I often recommend GI Psychology. Their team specializes in evidence-based treatments like gut-focused cognitive behavioral therapy and clinical hypnosis, proven in dozens of studies to significantly reduce symptoms and improve quality of life. These therapies work, and GI Psychology delivers them exceptionally well. They're also the only practice of their kind seeing patients via telehealth in all 50 states and Washington, D.C. So wherever you are, expert care is accessible. If you're ready to feel better, schedule a free 15-minute phone consultation at gipsychology.com. It's a chance to ask questions and see if it's the right fit for you. GI Psychology is a trusted resource, and they might be the next step in your path to relief.
So I want to just switch gears a little bit, Dr. Mayer, and talk a little bit about the potential for diet and maybe even probiotics and sort of giving individuals better response to psychedelic interventions. Is there any research out there, or do you think there's any evidence that these diet or probiotics could enhance the effects?
So I'm not aware for psilocybin, other than the recommendation before you have a session, you should probably not eat a heavy meal, because a minor side effect in some people is vomiting.
Mm-hmm.
I've had that experience, not in a major way, but if you had a full stomach, maybe this would be a bigger issue. It's not like with ayahuasca, where you have major side effects in terms of the GI tract. It's definitely nothing like that. And yeah, I would say the general guideline would be to not do it with a full stomach.
Any long-term, like just benefits to serotonin production or like enhancing certain effects because of dietary interventions, or is that just too pie in the sky?
I think at the moment, with the information that we have, I think it's pie in the sky.
Okay. We don't know.
I think we do see, I'll talk about this a little bit in my bit too, but we see like extremely variable responses to psilocybin, that the same dose can cause such wildly different experiences and different intensities of experiences. And some of that, I think probably most of that, it might be something to do with psychological factors. It might be something to do with serotonin receptor polymorphisms or other things that we don't fully understand. But definitely some of it, I think, could be like driven by or influenced by the microbiome. But I think at this point, we don't have anywhere close to enough data to say, like, if you eat X, Y, and Z, you can enhance these bugs and therefore maybe change the experience. I think we're like so far out from being able to say that, but it's definitely food for future research.
Awesome.
Food for thought.
Food for thought. I know, it was like on the tip of my tongue. Yes.
All right, Dr. Mayer, I think we're going to be piquing a lot of curiosity with this episode, but what guidance would you give to either clinicians or patients that are listening in terms of the unanswered research questions? What do you think we need to address before considering this wider adoption?
I think what we can say, and I totally support this idea that this high variability, I mean, some people have negative experiences, some people have and I count myself in this, some of the best experiences in their lives. And, I'm eternally grateful to the person that introduced me to it in the right way. So I think for physicians right now to recommend it for medical indications, I think that's too early outside a clinical study. I think if somebody wants to do it, I think to enroll in a clinical trial is the best way to do it. If somebody wants to do it for consciousness expansion, then they should only do it with a experienced guide or teacher that plays a big role in the quality and the extent of that experience. Just saying so, if somebody would come to me and say, I've tried so many things in IBS, should I try psilocybin? I would tell him, I can't really give you an evidence-informed answer to this because we don't know, but as Erin has, said earlier, I mean, there are studies that people are now looking for patients. Same at Stanford, they're advertising for study participants. So this is what I would recommend right now.
Yeah, we don't want people going out into the forest and foraging these magic mushrooms on their own and trying to do this in their own home without a guide. There certainly have to be some safety parameters that I think give people the best opportunity for potential.
Yeah. And I mean, I have sort of an interesting exposure to this whole field of psychedelics. So we live in a place in Los Angeles which has a long tradition. So Topanga Canyon, going back into the 50s and 60s. And it's kind of the epicenter in California for psychedelics. And this, once you get on the mailing list, almost every week there's another event that's somewhere. They're called prayer ceremonies. So there's never the word of psychedelics. And I've gone to a couple of these just out of curiosity. I mean, they're beautiful experiences combined with sound bath and meditation and relaxation that I personally felt being in one of these sessions. Just the non-psychedelic part was already so wonderful that I would go back there even without any ingestion. So here's where we live. There's a lot of experience, also teachers, but in many places of the country, that wouldn't be the case.
Right.
Definitely not in New England, I don't think. But maybe.
Depends on the parts.
Yeah.
It depends on the parts.
So let's switch gears a little bit. So we've talked mostly, to both of you, but with an emphasis on Dr. Mayer. And now I want to kind of switch gears to the work that you've done, Dr. Mauney, really looking at neurogastroenterology, psychology, brain-gut connection. You've started this study at Mass General, which is really where I personally learned about psilocybin from you. And so let's get into some questions.
Again, we've been talking about psilocybin now for a little while, but how might it reset our brain-gut connection in someone with IBS?
Yeah. Well, first, thanks, Kate, for taking my cold email to talk about this subject. I think that speaks a lot to your open-mindedness, and I really appreciate you being interested in this. And to answer your question, Megan, I want to kind of walk back a little bit from some of the hype that I think psychedelic research can get caught up in. So I think I would say that reset is maybe too strong of a word, because I think it kind of implies that psilocybin is a one-time or a few-time treatment, and then almost by magic, you take the drug and everything is fixed. Everything is reset. And I think that it has a couple of problems. One is that it makes the person's subjective experience almost like secondary, like it doesn't really matter what the person's experience is. They're just a passive recipient of this medicine, and then things are fixed. And also, I just don't think that that's really how it works, or how really psychedelic researchers sort of think about the kind of unfolding process that is started, hopefully, by these medicine sessions. And I think that's true whether you're talking about using psychedelics for IBS or depression or what have you. So I think what we've seen in our study is that psychedelics are very powerful neuroplastic agents. And this has been seen also in other studies with strong neuroimaging components, as Dr. Mayer mentioned. We see that classical psychedelics, which includes psilocybin, are serotonin agonists. And so they bind throughout the body and in the brain to the same parts, the same receptors that serotonin binds to. And what neuroplastic really means is that psychedelics seem to open up kind of this window in the brain where new neural pathways can be formed, and that the brain can become much more malleable to how it approaches problems, and sort of in your day-to-day life, how you approach ways of being in the world, but also how the brain approaches interpretations from the body in terms of chronic pain or how it sort of interacts with the peripheral, nervous system. And as we mentioned earlier, we don't really know yet if psychedelics also create neuroplasticity at the level of the gut. But again, the gut is full of neurons, the gut is full of immune cells that are all being acted upon by serotonin. So I would find it very surprising to find out that that was not the case. So I think that there are probably changes being elicited in the gut as well as the brain, really throughout the body. And so really we think of psychedelics as like a catalyst, kind of, or like a boosting agent, and that it's really not just the psychedelic, but as Dr. Mayer also keeps mentioning, it's really the psychedelic-assisted therapy itself. And so our study also actually has a lot of therapy. So we have, just to give a little bit more context about the framework that our study takes, which is similar to studies that have been undertaken for like PTSD or depression. We have 2 therapists that are assigned to a patient. And in our case, they're all psychiatrists, 1 music therapist actually, but they're all, sort of PhD level therapists. And they are paired with this person throughout their whole journey. And they start with a preparation session. These are like 2 sessions that are 90 minutes to 2 hours each. So again, already a lot of therapy, already a lot of getting to know a person's life history, how they're living currently, how they manage stress, etc. And then explaining how the psychedelic dosing days will actually go and kind of helping the patient role play different ways that they might manage parts that feel scary or uncomfortable, sort of how to kind of trust, let go, and be into the process. And then on the dosing days themselves, the person takes, in our study, 25 milligrams of psilocybin, which is equivalent probably around to like 3.5 grams of dried mushrooms, which is for most people enough to elicit a quote unquote psychedelic experience where they have, visual changes, but also changes in perception, also kind of an openness to exploring like autobiographical material within their mind that might come up. And the dosing day is really inwardly directed. So the therapists are not like, think about your IBS right now. It's like nothing like that. It's just sort of that the person has music, they're internally processing, and they're having a variety of experiences, mostly on their own. And then the very next day after the dosing session, they return, talk about it with the therapists. And then the next week, more integration, more figuring out, oh, this came up for you. Like, how do you think this might be connected to things you've struggled with over time? How might you want to move forward differently? So those integration pieces are so key to take advantage of this neuroplastic state. If a neuroplastic state's opened up and then you just do exactly the same things, is like a little bit of a waste. So we really want to take the time to kind of maximize and really build on those experiences. And yeah, what we're finding is that like, rather than sort of resetting IBS in the patients who this therapy is really working the best for, it's people who are able to, after this therapy, see their IBS and see their life in a different lens, and to maybe see the early life roots, as Dr. Mayer mentioned, of kind of where this all started from, or to see, in the present day, how their partner or their stressful job or their life or just other things like outside of the gut ostensibly are impacting their gut. And then also people have often these like very beautiful and enjoyable experiences, and they feel really safe and happy in their bodies in a way that they maybe haven't before. And that experience can also be kind of like reparative. We have had, interestingly, a few people who have done very well with this study and have had their IBS disappear, reset, I guess, in this case. I'm thinking of 2 participants who had these like very beautiful and profound visuals that then they were able to, they write about their experience after the dosing day, and we read them and are studying those kind of for qualitative themes. And the people who really like hold on to these experiences, they often have these strong visuals that they can then like hold on to and bring forward into their life. And then patients often, again, who have success from this will make big changes following the experience. So they might make dietary changes that they have not really had success sticking to in the past, or do kind of any number of other things that really like keep the work of the psychedelics going. So that might include like yoga, journaling, meditation, things that I think it's easy to like sort of pay lip service to before. But I think this experience can really help people feel that these practices might be calling to them in a different way and really like bring it forward in a more solid way. And so, yeah, we think that this sort of relaxes these previously held rigid beliefs and opens up this neuroplastic window. And that may be why people are able to actually stick to these things that, like, of course, they might say, I tried yoga before, it didn't help me. But now maybe other therapies that have been suggested to them before, they're more open to and that they feel more engaged with. So I think that was very long-winded, but basically I don't think that psilocybin on its own like resets everything, because the dynamics of a brain-gut disorder are just so complex. But I think it's just this very powerful tool that can help rewire the brain, help rewire the peripheral nervous system as well, and help people understand their symptoms differently and feel safe in an embodied way and kind of carry, hopefully, those changes forward with them after the dosing. And we often tell people, you might not feel like cured by one dose. Don't expect that. That's not a helpful way to go into things. But this might start a process of change for you that could last the rest of your life. Who knows?
Amazing.
So I think you're highlighting the fact that, for all of us looking for that magic pill, that magic cure, that magic reset, it's not there. Really good IBS research is showing us how there's a retraining. And we talk about that with gut-directed hypnosis, that it's a retraining of the way the subconscious thinks about the functioning of our gut and experiences. And I've heard Dr. Mayer now talking about it and you talking about it. It's almost in some of the psychedelic research, we hear people saying it's like a rebirth, a reemergence, an opportunity to explore again how you want to go about living your life. So it's truly fascinating. And the way you describe giving patients the safe experience, the importance of a multidisciplinary team, that again, this is not a one-off situation that's taking place. It's really a journey, as you explained it.
Exactly. I would like to know, like, just some of I know you did like IBS symptom severity scores and some visceral hypersensitivity scoring in this study. Can you give us a little snapshot on that data from your study? Is it free to share?
Yeah, it's free to share. And I gave a presentation at Psychedelic Sciences earlier this year, which was in June in Denver. Amazing conference. Highly recommend it if anyone's interested in this space. Like no conference I've ever been to, with people, the VC pharma people walking around in suits and then other people walking around dressed as mushrooms. It's like really an eclectic mix of a really wonderful experience. And I presented sort of our interim results there. And I'm also happy to like provide those slides to you, Kate, if anybody wants to see them visually. But I think the overall like takeaways, one is that our study, this is the first study in the US, or I think in the world, that is looking at psychedelic-assisted therapy targeting a GI indication. So mainly the outcomes that we're sort of powered for, or not even powered for, but the things that we were looking for are just safety and feasibility. So that's the main things that we can report on. And we did find that the intervention is generally safe, but we did have one patient who developed suicidal ideation. So I did want to highlight that, because I think this shows that psychedelics are not for every person and they're not without some risks. And it does highlight the need to kind of think about these agents in a supportive, structured setting. With the patient, the suicidal ideation resolved and she's plugged in with her own therapy now outside of the study. But I did want to just mention that. And then in terms of like the actual dosing day itself, we found that most participants experience the dosing days as very intense. And we measured that on this mystical experiences questionnaire, and also have a challenging experiences questionnaire to try to get a sense of like how the day was for people. And so what we found is, I think by the time I prepared these slides, I think we had dosed like 6 people. And I think 4 of 6 or so had like pretty intense experiences, maybe not fully mystical, but pretty high scores on those questionnaires. And then the experience between the 2 dosing days within the patient were pretty much the same or very similar. But between patients, as I mentioned, can be totally different. Like we did have one patient who only did 1 dose in the study and then dropped out because he was like, I didn't really feel anything. I didn't really like the way that felt.
Okay.
And then other people were like blown away. So it was just kind of like eye-opening to us, because we're like, as physicians, it's hard to give a drug that could have like such completely different effects on different people.
I just want to go back to something that you said earlier. I think it's really important. So typically, the treatments for IBS, the traditional treatments, and I mean, our center was involved in many of these attempts of the pharmaceutical industry in the 80s and 90s to develop, receptor-targeted interventions, gut receptor-targeted interventions. And I would say pretty much none of them really came out with something that has changed the field. So psilocybin therapy is completely different. It's not a pill that you pop in the morning and then that's it. That's all you do. You have to do the active work, both with your therapist, but also the ongoing process. It's changing more than some gut functions. It changes the paradigm that you evaluate, the world around you and your symptoms. And I think this is the fundamental difference. It's not the pharmaceutical magic pill. And I mean, we see this now with different medications. I mean, it's the same with the GLP-1 agonists, that it's not just getting the shot, it's implementing all kinds of other lifestyle modifications at the same time. It's definitely a new paradigm for developing treatments for chronic medical problems. I think you have to combine it with more than just the pill.
Yeah. Which is so exciting to be like a young physician starting now, because this is exactly how I want to practice. This is exactly how most of the people I know want to practice. And I think, patients and physicians are just like not really satisfied with this approach of seeing someone for 10 or 15 minutes, prescribing a medicine and seeing them back in 3 months and being like, did the medicine work? Like, no, that's not how anything works. If only it were that easy in life, to make actual deep changes to the way you live and the way you relate. But on the counterpoint, it's just exciting to see that there is more openness to these kind of interventions that do take more time.
I just want to step back, but on one of your slides, because you did share them with me, one of the participants had sort of this vision of turning their IBS pain inside out and pushing the pain out like feathers were kind of flying or something like that. And using an imagery like that, I think of gut-directed hypnosis with using imagery and just replaying that in their mind, like how it was an image that came to them and seemed to help going forward. So I just wanted to share that, if that's okay.
Yeah, no, I mean, exactly right. Like, we didn't build any gut-directed hypnosis into this therapy manual. We wanted to. I kind of wish that we would have. But what's been interesting is that even without that explicit, guidance, people have sort of come up with their own gut-directed hypnotherapy. And then the people, like I mentioned, that have really benefited the most, hold on to these images. And as you say, replay them. And so, yeah, just to wrap up, coming to the preliminary results, I just pulled up the slide so I can remind myself too. But when we looked at the IBS SSS, 5 out of the 6 patients had the clinically significant response of greater than 50-point drop. And it was durable out to 6 months, or even improving out to 6 months for most people. And this patient actually that you mentioned that had this strong visual, she started the study in what would be the moderate severe score for IBS SSS. And at 6 months, the score was 0. So I initially, when I made this slide, I had to go back because I thought there was a problem with the data. But I was no, literally 0. This patient has just complete remission of symptoms, which is just incredible to see. We saw some similar changes for visceral sensitivity. Basically, everyone's visceral sensitivity index improved. That was also durable out to 6 months, where we have the data. One interesting thing was that we thought that a lot of this would be mediated by psychological flexibility, which is a construct from acceptance and commitment therapy, which is sort of what our therapy model is based on, trying to improve people's ability to sort of be in the present moment, not kind of push things away. Didn't really change. Again, just 6 patients, so who knows? But it almost seems like there's something happening more at the level of the gut. It's more embodied in a way that they're having these symptomatic changes without necessarily psychologically feeling like they're approaching things differently. And then one of the metrics that I found the most interesting is that we have people, they have this iPad and it has 2 circles on it. One circle, we say this represents yourself, your whole life. And this other red circle represents IBS. And please drag the IBS circle where on the iPad it makes sense. And it could be partially overlapping the yellow sense of self, or it could be far away. People understand it right away what the task is that you're giving them. And the self-illness separation is the distance between those 2 circles. And so we know from other kind of pain and other studies, not necessarily IBS specifically, but having a larger separation of self from illness is associated with better outcomes, because then you're not sort of saying, I am IBS, right, but it's just something that occurs sometimes in my life, but you have a more balanced approach towards it. And the self-illness separation increased for everyone. And that was also durable out to 6 months.
So amazing.
So these are interesting outcomes. And of course, they're all kind of self-reported for the most part, but this is a subjective illness. It's the symptom-based illness, right? So if people tell you that their symptoms are improving, then I think that's really exciting to see.
And how many people will you study? Is it going to be a larger cohort?
Yeah, we're enrolling 14 patients. We currently have 10 enrolled, so we're looking for the last few people. We are still recruiting, so if anyone is listening to this and is in the Boston area and is interested, I can also send to Kate the contact to reach out to. But we do want people to be local to Boston because, as I mentioned, it's a lot of therapy and it's in person. But that's our goal, is to get to 14.
Perfect. We'll put that link in the show notes for anyone listening that's interested and lives in Boston.
One comment about the visceral sensitivity index that you mentioned. I mean, sensory sensitivity is a major variable in this psychedelic experience because your sensitivity to visual, auditory, olfactory stimuli changes pretty dramatically to essentially experience a different reality. And I mean, we don't know, it's just a speculation. Maybe it's a rebalancing once you come out of the actual experience, that it's a rebalancing of the sensory processing in your basal ganglia or somewhere at your higher level that normalizes the visceral hypersensitivity. But in IBS patients, we know in the meantime, it's not just the viscera. I mean, they are, if you ask them, it's auditory, it's visual. Most patients have multiple increased sensitivities, and the rebalancing of these, something as simple as that could be the major reason that people get rid of their IBS symptoms.
Interesting.
Potentially, it's a speculation, but.
All right. So I'm going to switch gears. I think we'll do our speed round because we're wrapping. So we're just going to ask a few rapid questions, one word, one sentence answers, just to kind of get your level of expertise. So I'm going to start with Dr. Mayer. What are your top 5 must-have foods for gut health?
General answer, all the foods that increase short-chain fatty acid production in the gut, which have anti-inflammatory effects. So these are oats, cereals, complex carbohydrates. I would list them at the top because you have this. Second one is naturally fermented foods, which is not something that we add to our diet. It's something that humans have lived with for thousands of years and have mechanisms to respond to it. So I would say the combination of foods containing complex carbohydrates and naturally fermented foods are the 2 key ingredients.
Love it.
And Erin, what's your favorite morning ritual for gut-brain health?
I guess I would just say general, like, stress management. So for me, that the biggest thing that I've started doing in recent months is reading a few pages of a book rather than looking at my phone first thing in the morning.
Oh, I love that one. Okay, Dr. Mayer, which impacts the gut more, stress or diet?
Obviously, we know today that both of these factors are perturbations or stressors of the gut.
Yeah.
I would say, and that's not 100% based on science, but really on my career path, that the influences from the brain, the chronic stress, not any kind of stress, chronic persistent stress has the more profound negative effect on the gut.
We'll take that. Dr. Mauney, what's one thing you wish med school would have taught you about the gut?
I think we got into this a little bit in the podcast, but I would say that, medications like PPIs and antibiotics, they have a place for the short-term improvement of symptoms, but maintaining improvements really requires deep changes to lifestyle for most people, and that our health system is just deeply broken and not really set up to support this kind of deep change generally.
Agree. All right, Dr. Mayer, what gut health trend do you wish would disappear?
Well, the obsession with gut health
Yes.
encompasses a lot of different things.
Yes.
If you really, so why all of a sudden there's an explosion of that obsession with gut health? I mean, some people say it's the anxiety, it's a lot of different things. I think talking about things more specifically, a balanced interaction between the nervous system and the digestive system will probably be a much better way of focusing our attention.
Okay. And then one final question, intermittent fasting for gut health, yes or no, Erin?
I think yes for some people. And I think it's a place that's really fertile for self-experimentation. I think the science is pretty compelling that there's a lot of beneficial things happening under the hood in terms of, mitochondrial autophagy and just a lot of other things happening that can be beneficial with intermittent fasting or time-restricted feeding. But I do think like with anything, it's not for everyone. And there's people with a history of eating disorders or poor metabolic health, or people who are going to just end up breaking their fast with binges. And in that case, I think it's probably not worth it.
Great answer.
Man, so yeah, it's great. And with, all this innovation comes lots of complexity. Thank you so much for doing our speed round. And really, Dr. Mayer, Dr. Mauney, for your time today. This has certainly been a provocative conversation that I think are going to get our listeners excited. But as we know, no quick fixes. There's a lot of still ongoing research, safety concerns, ethical concerns that we have to be considerate of when we think about the potential of psychedelics. But we hope you'll join us again. And to all of our listeners out there, thank you for supporting our gut health community.
Thanks again to both of you. We really appreciate it.
Thank you for joining us as we grow this gut health community. We hope you enjoyed this episode, and don't forget to subscribe, rate, and leave us a comment. You can also follow us on social media at The Gut Health Podcast, where we'd love for you to share your thoughts, questions, and experiences. Thanks for tuning in, friends. Thank you for joining us as we grow this gut health community. We hope you enjoyed this episode, and don't forget to subscribe, rate, and leave us a comment. You can follow us on social media at The Gut Health Podcast, where we'd love for you to share your thoughts, questions, and experiences. Thanks for tuning in, friends.